Guess what? Some natural dental remedies actually work. I'm Whitney, a registered dental hygienist, and today we're talking about 3 natural remedies that have real science behind them. As an evidence-based healthcare professional, I don't rely on word of mouth or social media trends, right? In healthcare, especially dentistry, it's important to follow evidence-based practices. That means using the best scientific research, clinical expertise, and patient needs to guide care. Although anecdotes can be interesting, something you heard worked for someone when it comes to your health, we want facts and proof. That's why I'm normally very hesitant toward natural remedies because many of them have no scientific evidence. If you want to learn more about the differences between anecdotal evidence and scientific evidence, I'll link a video of mine below. But for the purpose of this video, let's get into the 3 natural dental remedies that actually have some scientific evidence behind them. Starting with number 1, saltwater rinse. This one's simple but powerful. A warm saltwater rinse can help reduce gum inflammation, soothe sore gums and mouth tissues, as well as promote healing after dental procedures. The salt creates a mild antiseptic environment that makes it hard for bacteria to thrive. Whenever I have a deep cleaning patient or scaling and root planing a patient that needed an SRP, after the procedure, more likely than not, I'm recommending that they rinse with warm salt water for the next couple days. It's super soothing to the gums. It's like a natural disinfectant in your mouth. Just like doctors tell you to gargle with warm salt water when you have a sore throat, same thing goes for when you have sore gums. So mix about half a teaspoon of salt in a cup of warm water and swish gently. Don't swallow it. Yeah, this natural remedy does have science backing it up. Number 2, dry brushing. Brushing without using toothpaste. Now, this sounds odd, but hear me out. Don't twist my words until you hear this whole part. So, the mechanical action of brushing, meaning the gentle scrubbing of bristles against your teeth and gums, is what actually removes plaque. Plaque is the sticky film of bacteria that leads to cavities and gum disease. Now, of course, toothpaste adds benefits as well, like cavity prevention ingredients and ingredients that help with sensitivity depending on which toothpaste you use. But even without toothpaste, brushing properly, the toothbrush itself still improves gum health by stimulating blood flow and disrupting plaque. I'm not saying to not use toothpaste, because if you stop using toothpaste, you are at a higher risk of getting cavities since you're no longer getting those extra anti-cavity ingredients. But what I'm saying is brushing technique is everything. So you want to check yours. Are you using proper technique with your toothbrush? You should be using a different technique, whether you use an electric toothbrush or a manual toothbrush, because proper technique, dry brushing, is of utmost importance for your gum health. And then using a good toothpaste is second in line of importance. Both important, but the dry brushing, the brushing techniques, the manual removal of plaque is often overlooked. So I thought it was worth mentioning in this video. I will link my free oral care guide below with tutorials on brushing, as well as flossing, tongue scraping, and more if you want to check to confirm that you are in fact using proper techniques. And lastly, number 3, oil pulling. Okay, before you panic, I do have plenty of videos explaining why oil pulling by itself is not a substitute for brushing and flossing, and that's still true. I also have a video saying I would never oil pull myself, nor recommend it to my patients, because there isn't much research showing its effectiveness, so why would I waste my time or want to waste anyone else's time? Because current studies show there truly isn't enough evidence to prove oil pulling alone prevents cavities or gum disease. But here's the interesting part. When people add oil pulling to their routine, of course, without replacing brushing or toothpaste or flossing, they are just adding it to their routine, something in addition they are doing. I've found that these are the patients that often end up spending more time on their oral hygiene routine at home overall. So now that they added in the extra step of oil pulling, they are also making sure that the other steps are solid, like brushing and flossing properly, giving extra effort in each step. And scientific research does show that longer brushing sessions, making sure you are brushing for the full 2 minutes, as well as more consistent flossing, does improve dental health. So in that sense, oil pulling can indirectly help by encouraging better home care habits overall. But of course, remember that oil pulling does not replace brushing and flossing. You still need a toothbrush and floss, but if you want to also add oil pulling into your routine because it's gonna get you going, no problem. Maybe doing it will improve your overall brushing sessions because you're committed and motivated. It's kind of like skincare. The more things you do, the more products you add, the more steps to your routine. Maybe they aren't all needed, but at least now you're washing your face every day, you know? Anyway, overall, yes, there are a few natural remedies that are backed by science, even if indirectly. But the most important thing is consistency with the basics. Brushing twice a day with an anti-cavity toothpaste, flossing daily, and regularly visiting your dental office for routine cleanings. If you've heard any other natural remedies and want me to break down whether they actually work, drop them in the comments. I always love debunking or confirming dental trends. There's a lot out there. But just remember, if it sounds too good to be true, it probably is. If someone is making money off of trying to sell you a special fluoride-free toothpaste, remember, conflict of interest. I will link some of my fluoride videos below if you have any questions about that. And until next time, I'll see you on Instagram at Teeth Talk Girl. Peace, love, and teeth.